Is that happening at a national level too? Because I thought I was reading
Mm.
something recently through the ACLU
Uh-huh.
that was also talking about how some folks maybe would go to like a neighboring
Mhm.
state to receive care or whatever, but even that is potentially going to be blocked in some way. Or is it a state to state kind of situation?
So right now, my understanding is it's state to state. That does not mean it couldn't change, but you've got like Washington State, who is like doubling down on protecting trans rights, access to abortion, access to all of these good kinds of care. I was literally just like scanning through some of the legislation that Washington State is introducing, and I'm like, oh, we could be like actually taking care of people. How beautiful.
Right.
That act is concerning to me for a number of reasons, because we've seen these before where it's like it's anyone who provides care, right? It's first responders. It's even when I was reading it, even a pharmacist can say, so like you can jump through all the hoops. You can finally find a doctor who's like, I'm going to prescribe you your HRT, and then your pharmacist can be like, actually, that goes against my beliefs, and just and that's okay. And I feel like you're exactly right. It's opening the door for any kind of prejudice to be acted upon just with this hatred and refusal to care for people.
Yes.
And it's starting with us, but it's not ending with us.
Probably birth control as well. I know abortion really isn't an issue now because we're in Idaho, but like there's still access to birth control would probably become even less.
Yeah, it is literally any sincerely held belief that somebody could say, I don't want to do that. Now there's supposedly provisions in there of like, and I mean, and it's written in there, they have to let the person know that they won't do it for that reason, so that there can be somebody else who comes in and does it. But we're, again, talking about a state that is very rural, right? Where access is limited already. And if we have a lot of doctors and providers and insurers who feel this way, how many people do you have to go to? The other aspect, and I'm a big, this is a horrifying bill. It's incredibly harmful. And also I like to be really clear on the reality of it so that people understand it.
Yeah.
This does not apply to emergency care.
Okay.
A person cannot deny emergency care based on closely held beliefs, which is an important distinction.
That's at least some good news.
But healthcare was never meant to be about emergencies.
For emergencies, yeah.
Healthcare is so much about prevention. And if we are not doing that kind of healthcare, that's going to lead to more emergencies.
Yeah.
What about the SAVE Act?
The SAVE Act.
That's this one's wild, everyone. Like every time I look at the news, I'm just like, what level of idiocracy are we on today? And this one is where anyone, and they're saying that it's aimed at women mostly, which is not great, but it's going to be the trans and non-binary community too. It's your legal name has to match the name on your birth certificate in order for you to be able to vote.
Okay, well, I need to look this one up.
Yeah, it's called the SAVE Act.
Okay, and that's at a national level, right?
I'm not sure, but
I
was
saw
introduced.
A woman from Utah talking about it on TikTok. So I think it's more of like a national.
It's not one I've heard in Idaho.
Yeah,
I'm pretty close to those, but it's definitely something I will look into.
Yeah, because it's gross.
Well, and when Trump, one of the executive orders that Trump signed was one rescinding many of the Biden administration protections or executive orders, 7 of them being protections that were focused on the LGBTQ community, including a voting one. And so, we're looking at the executive orders that he signed that were horrible. Well, he also rescinded a bunch of them. And this is all heavy and hard, and it's dark, rightfully so. And I will say that's why I'm so grateful for organizations like TransJoy Boise and some of the other organizations in Idaho who are really focused on building community. Because we have to do that.
Yeah.
This is a long game. This is not something we're changing immediately.
Well, and it's like I don't know how you do it, to be honest, because I feel like so powerless as it is and kind of like what's happening politically. So I think that's why a lot of our work has been about trying to take care of people right now in the moment, regardless of what's happening. But like you go every day, or you go there most days, and you're talking with these people that a lot of the times are not, they don't care. Right. They don't seem to be open
right.
or interested.